We're going to start with a brief intro as to how I'm going to be doing these muscle tests. This is the first groups are all going to be review from sessions 1 through 5. I'm going to present them more regionally. So we'll be testing all of the muscles first in the neck, upper back, shoulder area. And then we'll move into the muscles more in the front, like the pecs. And then I'll show you how to do some of the lower extremity muscles seated. And then we'll do some of those again in different positions. So that's how these next clips are going to be put together. This is Jane. This is our model for today. Beginning with the muscles in the upper back, shoulder, neck, we're going to start with the neck flexors. And they can be done seated, standing, supine. We're going to do them seated. Bring the head forward. You can test the neck flexors as a group bilaterally by going into straight flexion. Hold. I'm stabilizing her upper back against me, and I'm using both hands and just gently pulling back and feeling for the lock. Then we can turn to the left to emphasize the right scalene muscles as a group. Hold. And then turn to the right, and this will emphasize more the left scalene muscles. Very good. And from here, hands off the legs there, hold there, all the way into flexion, all the way into left rotation, and I'm going to stabilize her upper back, hold, and that is the right SCM, coming back up, coming into flexion, turn all the way to the left. My left hand comes along, a broad contact on her left head, and that is the hold, left sternocleidomastoid, SCM. Now, we're going to do the deltoid test. This is a deltoid as a group. I'm going to stabilize on the opposite shoulder, push into my hand. Good. I can also use a contact here, hold. Now I'm going to bring the arm into slight extension and about 20-30 degrees of internal rotation at the humerus, hold. And that's the posterior deltoid. Bring the humerus into slight flexion and about 20-30 degrees external rotation at the humerus, and that's the anterior deltoid as a general screen. Sit just a little bit to the left, Jane, right there. Now we're going to bring the arm up at would be about 45 degrees off horizontal abduction. And I'm going to have you hold. Good. Now that's the upper division of the serratus anterior muscle. We're going to go about straight horizontal, hold, and down about 30 plus degrees from horizontal, and that's going to be the lower division. So upper division, middle division, lower division of the serratus anterior muscle, which of course anchors to the scapula and then into the ribs and through here. While we're here, we're going to go to the upper trapezius. The way I always tell people to test this, get your hand placement first and then have the patient bring the shoulder up and bring the head over towards that shoulder and then rotate slightly away. Now I've got a good capture of her head and her shoulder. Hold. Okay, good. Now if that muscle wasn't firing properly, just let it go. It would be this kind of motion here. So on the other side, same thing. Get your hand placement. Shoulder up, head over, slight turn, and hold. Good. So that's the left upper trapezius. Starting with the neck, upper back, and shoulder muscles in the seated position. We're going to start with the neck flexors as a group and hold. Push into my hand, hold, good. We turn the head to the right and then hold. That gives me access to the left scalenes. We turn the head to the left and hold. That gives me access to the right scalenes. We bring the head all the way forward into left rotation, hold. I'm stabilizing her upper back. That's giving me a test of the SCM. Head all the way flexed, turn left, and hold. Now, going into the shoulder, upper back, the upper trapezius, you bring your hand in on the shoulder before you have the patient lift the shoulder complex. Go ahead and bring your shoulder up into like a half shrug. Slight turn away from the side tested, hold. Good. The left side, same thing. Bring your shoulder up. Slight turn. Reach over and hold. Good. Now, if that muscle was weak, Jane, just let it go. It would be this kind of motion. We're going to do the middle and lower trapezius in a little bit when we have her facing the other way. Right now, we're going to go into the shoulder. So the deltoid, as a group, we start with the arm at 90 degrees, elbow flex 90 degrees, and hold. You can test the group this way. You can bring the arm slightly forward, the humerus into flexion, a little bit of external rotation, hold, and then bring the elbow back into slight extension, little internal rotation, hold that right there. You see how my forearm matches her forearm, and that is really your vector in that test. Moving, so we got the upper trapezius, we got the deltoid. Moving into the serratus anticus, we're, what is it, about 140 degree flexion, slight, probably 30 or so degrees flexion from that position, with the humerus in external rotation as well as the wrist, stabilizing over the scapula, hold, upper division, hold, middle division, and lower division. Now we move down to about 30 degrees abduction, hold there, and that's the supraspinatus, the muscle right here on top of the spinatus. So we're moving deeper into the shoulder. We're going to go to the coracobrachialis. I like to have the wrist supinated, wrist and elbow supinated, the elbow fully flexed, slightly towards midline. I come in like so, stabilize here, hold, good, hold, good. So that's the coracobrachialis. While we're working with those smaller stabilizer muscles, the subclavius, head is neutral, stabilize at the patient's head, hold there. I'm going to push out at this arc. You push back, hold, hold. That's the subclavius. Here's the left subclavius. You can see it on this side. Hold. I usually do these from behind the patient. You can't do them from front. I think it's better. It's more stable to do them from behind. Moving into the pec muscles, which we also will do supine. This is the pectoralis major clavicular. Full internal rotation at the humerus with 90 degrees flexion at the humerus. The vector is going to be out in an arc like so. Hold there for me. Good. There's a strong one. This is the left side. Good. We're going to go into the pectoralis major. Hold, push into my hand. Sternal division. The patient pulls towards their opposite hip. Hold there. I'm putting my hand there just to stabilize so their body doesn't feel like it wants to rock. That's the pectoralis major sternal. We can also test the pectoralis minor muscle. You go to just across midline, elbows fully extended, hold. Good. And hold. And that one's really good. Bring that across there. And hold. Good. And really there, hold there. Now if it was weak, hold, just let it go. You'd get this kind of effect. The shoulder just wouldn't want to hold that slight flexed position. Jane, would you face that way for me? Now in class I talked about how the shoulder muscles, I think of them in several different categories. Some of the shoulder muscles go from the body to the scapula, some go from the body to the humerus, some go from the scapula to the humerus. So it's always nice to kind of keep that straight. Another two muscles that go from the body to the scapula is the rhomboid. You bring the elbow into full flexion, some pronation through the wrist and elbow, retrude the scapula, and have the patient look away from the side you're testing. Hold there. My vector is like so. If you could see it from above, it'd be like so. And hold. And that's pretty good. Now you drop the shoulder down and hold. And that's for the levator scapula. Same thing on this side. Retrude, head turns away. And now there's no elevation or suppression of the scapula. It starts in neutral. Hold there. We're just really looking for stability there. Drop the shoulder way down and hold. And that's going to be the levator scapula. While we're in this position, seated, we go into neck extensors as a group. I stabilize over the front of the upper sternum, broad contact. I get my arm down like so, hold. And now Jane, go ahead and let the muscle go. If that was weak, I would get this motion here. Hold, good. We turn the head to the right. We're going to test the right neck extensors. Turn to the left neck extensors. And those muscles also are related to fixations. Neck extensors as a group, weak, can indicate lumbar fixations. To either the right or left side can indicate a sacral fixation on that respective side. The other two muscles we can test in this position from behind is the middle trapezius. You're going to turn towards the side. I stabilize with my forearm across her upper back. I can feel the scapula if it moves. Hold there. Good. Now she tries to adduct that a little bit, and that's often what patients will do. And that will sometimes, and see, that's pretty good, but I had to kind of make sure. Now we bring the arm up like so. Once again, she's still looking towards the side you're testing. And I'm going to bring the arm around in front. Hold there. Good. In line with the fibers, which come down here. And remember that muscle, go ahead and turn your head to the left, is hold. Good. Hold. If it's weak bilaterally, those are good. Those are all good. Can indicate a thoracolumbar fixation. Consequent, or as well, the deltoids, if they're weak bilaterally, they can indicate a cervicothoracic fixation. Just to tie some of that stuff together. Cut. Focusing on the shoulder rotator cuff group, we already did the supraspinatus a little bit ago. The supraspinatus, once again, it's a little easier to do in this position because the arm doesn't, hold that right there. Hold there. Once again, that vector follows those fibers. So that's the S of the sits group, supraspinatus. Infraspinatus, we bring the humerus into above 90 degrees abduction. We externally rotate the humerus. The elbow's at about 90 degrees. I'm going to come in above her hand. I'm going to stabilize at the elbow, hold, and bring it down a little bit. There you go, hold. And that's pretty good. Now obviously you can test that muscle in this position. Some people do. You could test it all the way through, but to really isolate that infraspinatus, you want to have quite a bit of abduction of the humerus. And then you can go from there. So that's the I, the infraspinatus of the sixth group. The teres minor muscle, external rotator, strongest in the neutral position. Hold there, good. Hold there, good. Now obviously too, you can test that. Pretty soon you're testing it and the infraspinatus, but that's how you want to think. So the last of the four, that was the teres minor. The last of the four is the subscapularis. So the humerus goes to 90 degrees, elbows at 90, full internal rotation. Now, a lot of times the patient will protrude the shoulder. We want to go just to where if that starts to happen, we want to back off a little bit. Now, with some people, the starting position may be here, but you want a full internal rotation for them. Grip my hand like so. I come in like so. I'm supporting her elbow and her shoulder with my forearm. Push down a little bit, push into my hand. Good, good. Now bring it up, let it go. Now sometimes it might feel like some of the other muscles are kicking in, so I have to reposition and try it again. Hold there. And that's a good one. That's a good one. So those are all four of the rotator cuff, the muscles that attach directly into the cuffs. Supraspinatus, infraspinatus, teres minor, and subscapularis, way under there. Going to the teres major, would you sit around that? Teres major, and this is the way we test it seated. We can also test it prone. Make a fist for me. Put your fist right there. Bring your arm back. I'm going to support once again the top of her back and her shoulder. Hold there. Good. That's pretty good. That's the teres major. Doesn't tie in directly to the cuff. It's internal rotator and an extender of the shoulder of the humerus. Face this way again for me. We already covered the coracobrachialis, but just a quick review of that. We just did that a bit ago on the other clip. Coracobrachialis, very important shoulder muscle, and then of course the subclavius. Hold. Very important. Muscles, and then of course the pectoralis major clavicular and the pectoralis major sternal. Good. Please stand for me. And I'll show the latissimus dorsi. Go ahead and turn and face away from the camera. The latissimus dorsi is also a very important shoulder muscle. And the way we test it is it really works well with the patient either standing or seated so that the arm can hang down a bit. Elbow is straight and full internal rotation and adduction. So they make sure they're pressing against their own hip. Stabilize over the scapula, upper back, hold. Good. My vector is lateral and a little bit anterior. Moving from the shoulder down into the humerus, we're going to review the muscles that we did in session 5. Biceps, brachialis, and brachioradialis, the anterior upper arm muscles. Tricep lateral head, long head, and medial head in the back in the posterior part of the arm. So to do the biceps, bring the arm into just short of 90, about 80 degrees, and push into my hand. Good. And the wrist is supinated, That's biceps. Now we bring the wrist into neutral. Bring the arm forward slightly. Push into my hand. That's the biceps long head. Bless you.
Sorry.
Now the triceps muscle, the tricep is an extender. It extends this way, it extends this way, and it extends this way. So the lateral head, push down, would be tested with the thumb dialed out. The long head of the tricep would be tested with the thumb straight up. Also, we can come in this way and hold. More of a classic way of testing it. The thumb dialed medial, hold, is the medial head of the tricep. Brachioradialis, we come into the bicep testing position, but then we rotate the wrist into neutral and hold. And of course the muscle, you can see the muscle raise up when you test it. Very good. That's it.
You need to do that over, don't you? Because I sneezed. Glasses.
I'm going to do the whole thing over, okay?
Yeah.
Moving from the shoulder down into the arm, these are muscles that we did in session 5. Primarily the biceps, the triceps, and the brachioradialis. The biceps, short head, and brachialis we test with the elbow at about 80 degrees and the thumb rolled out or the wrist supinated. Hold. Good. The long head biceps we test with a little bit of humeral flexion, neutral wrist. Hold. Hold. Good. And I'll show the other side here. This is hold there. Good. And hold there. Good. The brachioradialis, the elbow is at 80 degrees, and instead of supination, the wrist is in neutral, and we're going to stabilize at the elbow. Hold. Good. And we look for that muscle to make itself known. Now, if you're too flexed this way, sometimes you'll miss them. You want to be not at 90, but about 80 degrees, if this was 0. So right there, hold. That's it. The tricep muscle, we have lateral head, long head, medial head. We test the lateral head with the elbow at about 80 degrees. Thumb rolled out, wrist is supinated, hold. Good, hold. Good. Now, with the wrist in neutral, the classic way is to come around in front, hold, and pull the arm forward this way. I'll show on this side, hold there, and hold. Good. And hold. Good. The lateral head of the tricep muscle, the wrist is fully supinated, and we stabilize, push down, hold, hold. Test like so. Same with this side, hold there. Good. Oh, the medial head. The medial head, we did that, right? Yeah.